Good afternoon. It's Erie County Executive Mark Poloncarz at the Rath Building in downtown Buffalo with another COVID-19 update. But first, before we get into that, I want to announce that there has been a severe thunderstorm warning that has been issued in the last couple minutes from the National Weather Service for southeastern Erie County, as well as the vast majority of Wyoming County through 3:30. As you can see from the radar, there is a very significant storm that is just sort of popping up and has some very strong winds associated with it, as well as hail. So if you are in the line of the storm to the east of it, you should take cover. We want our people in the Western New York region to understand that this is sort of popping up very quickly, as you can see, based on the radar image straight from the National Weather Service. So I'm just putting a warning out there that this severe thunderstorm warning has been issued by the National Weather Service. And if you are east of the area where that line is, I suggest you take cover and get inside right away. It is going to be heavy rain, strong winds, and hail is being reported with this line of storms. So now let's get back to what we normally would talk about, which is COVID-19. Once again, I'm Erie County Executive Mark Poloncarz, and I'm joined here today by our Commissioner of Health, Dr. Gail Burstein, as well as Karen Gambino from Deaf Access Services, who will be providing the American Sign Language for you today. I was just switching over to our update screen so that we have the latest for COVID-19 up. We certainly have a lot of information to talk about in the 2 days since we gave a presentation, and there's a lot of important information that I hopefully think you will take from it. As always, there are provisos that the latest information can often be found on our website at erie.gov/COVID-19, and of course you can also check out our COVID map at erie.gov/COVID map. As of this morning, there were 4,732 total positive cases out of 28,663 people tested. This is a little different. The total positive case number really hasn't changed because that was the exact number of individuals who have been tested positive. But we've made a little adjustment as we've been cleaning up data. We've taken out duplicate testing for individuals. We've also taken out individuals who tested from outside of the area but have been tested in Erie County, like someone in Niagara County who tests in Erie County or elsewhere. So there actually are 28,663 Erie County residents, just one test apiece, if someone tested positive and then retested again, and 4,732 positive cases. So 4,732 positive persons since the beginning of the COVID-19 outbreak out of 28,663. Our epidemiological staff at the Department of Health, in consultation with Dr. Burstein and myself, changed it, and I think it is much more accurate for the general public so that we know that these are the number of individuals who've been tested and tested positive. As we announced a little earlier, 411 individuals have unfortunately died. 11 individuals yesterday. This is through yesterday, the 14th. These were all lab-confirmed cases, and there were no presumed positives. And as always, I offer my deepest condolences and sympathies to the families, loved ones, and friends of those who've lost a loved one as a result of the COVID-19 outbreak. Hospitalizations is always a very important number, and it matters towards our metrics towards reopening. On May 13th, there were 201 hospitalized individuals admitted to Erie County hospitals. 63 of them were in the ICU, and 50 had an airway assist. You can look at the statistics here. This is the last 14-day period. We have seen a decline in overall hospitalizations over 14 days, but the state standard is not just a straight 14-day decline. It is also based on a 3-day rolling average. And if we had a 3-day rolling average that also showed less than 15 hospitalizations, we would be able to reopen. Unfortunately, under the state metrics, we are not. I'm not really happy about a lot of what we're seeing, not so much with regards to where our numbers are going. We are headed in the right direction generally. However, I am disappointed that the Finger Lakes region was able to reopen with numbers that actually were going the opposite way, going up, while we actually are going downwards, and in this metric we have not been met. I've expressed my concern to the state about this. I understand the way the metrics are done, and I understand their concern. But it is a little disappointing to see the Finger Lakes region, where Rochester is, but also includes Wyoming and Genesee County, included as an area that meets the metrics, even though their hospitalizations are trending upwards. And our hospitalizations are going down as a region. And to give you a little bit more data, particulars associated with the residents in Erie County, in hospitals in Erie County, from the CEOs. And I was able to get from them that there are actually 4 individuals that are in hospitals in Erie County who do not reside in the Western New York Economic Development Region. They reside outside of it. So that we are bearing some of the patients from other regions. There are no individuals in hospitals that we're aware of in Erie County that live outside of New York, but we do have 4 individuals in hospitals as of this morning who reside outside of the Western New York Economic Development Region that are in our hospitals, and we're going to take care of them, of course, but they are included in the data with regards to patients in Western New York hospitals, even though they're not a resident. It's statistically not a lot. We're really talking about 2% of the overall hospital population, but it is not 100% indicative when we show these numbers of the individuals in Erie County hospitals being Erie County residents. We always knew there were not. There's a lot of Niagara County residents, Chautauqua, Cattaraugus. I believe there's one from Allegheny County as well, but there are actually 4 individuals in hospitals in Erie County that reside outside of the Western New York Economic Development Council region. Admission data with regards to admissions and discharges. This is something we keep track of, and the state does as well. For one day, we actually had spiked above 2.0 admissions per 100,000, and then of course we had a big drop or big discharge numbers, and the admissions are not as bad. They're certainly a little higher than we'd like. There's 16, and remember, you want to have less than 15 on a rolling day average. But we did have an increase in admissions over discharges on May 13th, if I can read that correctly with my glasses on. Hospitalization data, I think this is important for the public to know. Too many people are saying, oh, it's only old people in nursing homes and hospitals. We know that is not correct. I've been talking about how approximately 45% of the individuals in Erie County hospitals are 64 and under. And this is a little interesting 2 charts, graphs you have here. It's for May 12th and May 13th. And you will note that between May 12th and May 13th, our hospital actually, we saw an increase in the amount of patients under 64 and under, and a decrease in the number of patients 65 and above. There were 20 in the age range of 20 to 44 on the 12th. They're now 22. And then there were, I gotta take my glasses off for this one. 66 from 45 to 64 on May 12th, and there were 70 on the 13th. So it just goes to show that it's not just seniors that live in a nursing home that are being hospitalized. And we think it's very important for the public to understand that. And why we are in some ways still in the pause order here is because we have younger people being hospitalized. And unfortunately, the contraction rate is still out there. People are being tested that just contracted the coronavirus and being found to be positive. So it's very important that we continue to stop the spread as best as we can to reduce the number of hospitalizations, but moreover, just reduce the overall spread of the coronavirus. Here is the hospital data for Western New York as of today, which is actually through yesterday, and you'll see there was a nice little decrease from the 13th to the 14th. We do need to see that decrease continue. I've had multiple conversations with state officials in the last 24 hours, especially about the difference between Western New York and the Finger Lakes region, and why we're in general going down and the Finger Lakes is going up, but they can meet the metric because they've had less than 15 hospitalizations on average for a 3-day period. We have not, but I want to see that number continue to go down. That is how we're going to open up. When that goes down, the deaths in hospitals go down, and we'll have a much better chance of meeting the metrics to reopen. Just some of the information regarding age and gender in Erie County by all cases. You will note that there are over 700 cases in the 80 and older category, but there's over 700 as well in the 50 to 59 category, and there's nearly 600 cases in the 40 to 49 category. 30 to 39, nearly 700 cases have been recorded by all labs, including our Department of Health. So this is a disease that anyone can get. We have had, and I do know there's at least one case of a child under the age of 1. It's just too small to show up on the screen. But between 1 and 4, 5 and 9, we're not testing a lot of children, so that number is not as high as it potentially could be. But we are worried, and Dr. Burstein will talk very soon about another thing we're very worried about with regards to children, and that is the new respiratory illness that you may have heard of. Mortality data. This is showing based on the age range and where the deaths are particularly coming from. And once again, we are seeing it in the 70 and over category. 54% of all deaths that have resulted from COVID-19 are 80 and above, and they only make up 4.8% of our population. So our very older senior population is being significantly impacted by COVID-19. I think it's very important for people to understand that. Same thing, here's the data with regards to gender and the age ranges, and you can see, as we've shown, that males make up the majority up until you hit the 80 and over range, and then females make up the majority at that point. Mortality data based on race and ethnicity. This is through May 15th. We have not updated the data to include deaths for today, so when it says through May 15th morning, it really means through the end of May 14th. And there are 208 males, 203 females. African Americans have been steadily making up about 18.5% of the deaths. It was much higher earlier, it's dropped down. African Americans make up 14.5% of the population, so it's still a little higher than it should be. And Latinos make up over 5% of the population, and they're lower than where you normally would expect them based on population. I'll turn it over to Dr. Burstein to talk about common comorbidities of individuals who've deceased from the coronavirus.
Thank you. So we know both in New York State and in Erie County, unfortunately, the people that end up dying with COVID-19 related health problems, most of them have some type of comorbidity. And so you can see these are the lists of comorbidities that have been associated with COVID related deaths in New York State on the left and in Erie County on the right by frequency. So you can see a lot of these comorbidities are common problems that many people in our community share, like high blood pressure, diabetes, high cholesterol, any type of heart disease or kidney disease. In Erie County, we're seeing a lot of deaths among people who are former smokers. So just to let people know that the deaths are really hitting hard among people that have other health problems. It doesn't mean that people who don't have any other health problems, aren't immune to severe illness. So just I want to make sure that people try to stay as healthy as they can with whatever conditions they have. And remember, the hospital is a safe place now. And so if you're having trouble with your diabetes or your high blood pressure, it's really important to contact your primary care provider or whatever provider helps you with that chronic condition to get it back in order to stay healthy and safe. And if you do encounter COVID-19 and you do become infected, hopefully you'll have a more benign course. So one other thing I want to talk about is really with our pediatricians in our community have been on the lookout for is pediatric multi-system inflammatory syndrome. And so that is a syndrome that we're seeing that we believe is related to COVID-19 among children. And we've been seeing it in New York State with children who have a known diagnosis of COVID-19, and we're also seeing it among children who we were not aware had COVID-19. They didn't have any illness when they were infected, and we're only finding out after the fact when they're admitted with this severe illness, and through testing with either the molecular diagnostic test, the polymerase chain reaction or PCR, or an antibody test that showed they had a prior infection, that they were infected with COVID-19. So some symptoms that we typically see with this and that parents should be on the look for are these kids have usually a prolonged fever, so for fever for several days, usually 5 days or more, that is difficult to suppress. Many of the kids have GI symptoms like abdominal pain or diarrhea and vomiting. And there's also a lot of skin changes. So many kids have bloodshot eyes or like peeling skin, especially around their lips. They might have other rashes like red blotchy rashes or pale or even becoming blue. So those are the most common signs that we see with this pediatric multi-system inflammatory syndrome. Other problems that you can see are difficulty feeding, drinking, difficulty breathing, very fast beating of the heart because they may be going into some type of heart failure, and then different neurologic problems like being very tired or irritable or confused. So this can hit very hard. It ends up being a multi-system organ failure, and so kids really need to be evaluated. So again, don't be afraid to call your healthcare provider. Don't be afraid to go to the emergency department if you're worried that your child may have this syndrome, because we know that it has killed children in New York State and the rest of the United States.
And Dr. Burstein, while we do not have a confirmed case, we do have a number of suspected cases. Is that correct?
Yeah, there have been 3 suspected cases that have been admitted to Oishei Children's Hospital. Fortunately, they have all been discharged, and they didn't, quite meet the criteria. They are under investigation by New York State.
Thank you. Erie County responds. We've been doing a tremendous response as best as we can. We know we've had difficulties with obtaining testing kits, but we've since then really ramped up testing to the point where there's testing available in a lot of places. But before we get to that, which I thought was first, we'll get to childhood immunizations because it's an important one. And Dr. Burstein, I'll turn it over to you.
Right, thank you. So, we know from looking at our surveillance data around immunizations that there are a lot of kids that have not been going to their to their primary care providers and getting their routine immunizations. I think, people are worried to go into a doctor's office. Again, the doctor's offices are safe places. There are very strong guidelines that are evidence-based that have been put out by the American Academy of Pediatrics, so guidance for pediatricians to make sure that they keep their offices safe and COVID-free, and making sure they have separate places for people that are sick to be seen, that are different than kids that are coming in for their well child care and their immunizations. So, if kids are not getting their immunizations, then we can see not only COVID-19 in our community, but we can see outbreaks of other vaccine preventable diseases like measles or whooping cough or mumps or chickenpox, and we don't need that on top of the COVID-19. So also the pediatricians do some other important screenings like for developmental delays and other health conditions that are really important for kids to get. So please, take your children to their pediatrician for their well child care. Take them for their immunizations. These are really important healthcare opportunities that we just cannot forego during COVID-19. Remember, flu season is just around the corner. We all have to make sure that we get our flu vaccine, in light of the COVID-19 that is going to be in our community for a long time. Thanks.
Thanks for that positive message, Doctor, about flu season.
Sorry.
Oh, she is a pediatrician. She doesn't know what she's talking about with regards to childhood illnesses. But oh my Lord, I don't want to think about the flu season just yet. Now we'll talk about COVID-19 testing. And there is plenty of it. We're moving it to different locations across Erie County. We're not keeping it in one static location as a drive-through testing location. So if you believe you have been exposed or at a risk, you qualify. You do not have to show symptoms. Call 716-858-2929. You do not need a laboratory order or doctor's referral. You don't even need to have a doctor, but it is by appointment only, and it is a drive-through testing site. There are clinics all available in different locations, so hopefully there'll be one that will fit your needs. If you are symptomatic, if you're showing the illness, you should get tested, and sooner the better. If you needed foreign language interpretation is available. I want to turn it over to Doctor because we're dealing with an issue that has cropped up with our testing site, which is causing a little bit of a problem on our end.
Thank you. So our nurses that are working very hard and in all different types of weather, swabbing people to make sure that they can get tested for COVID-19, have told me that there have been a lot of no-shows to our clinic. We're trying really hard to take them throughout Erie County so that everybody has access to COVID-19 testing who feels that they need it. So if you make an appointment with our hotline at 858-2929, please make the appointment. Please show up. And if you find at the last minute that you're not going to be able to show up, please call and let us know, because you're taking the spot of somebody else who otherwise would have gotten tested and are on a wait list. Again, if people have symptoms, they should let the call takers know, because we will definitely squeeze you in for the very next day, or sometimes the same day. But please, if you're going to make an appointment with us, please show up or call if you're not going to be able to make it. And also, please give the call takers the correct phone number so we can contact you in case you don't show, and we can find out what's going on. So that's, really important. Just, it's just what you would do with your own healthcare provider if you couldn't make an appointment. Thanks.
Thank you, Doctor. I'm going to take the PowerPoint off the screen for a second so I can go back to the weather, because the report that we are getting is that there is quarter-size hail associated with this storm. So I just wanted to go back, and you can see the line has really exploded. If you can go and put it on the screen, it literally, this line of thunderstorms goes all the way across to almost Watertown, but it is really strengthened. It's moving fast. We have a severe thunderstorm warning, but we're also getting reports of quarter-size hail, which is some of the largest hail I've heard of in this region in a while, associated with this band of storms, and you see another band of storms entering. So if you are to the east, and this is moving very rapidly, please take cover. If you are on the road, you may want to try to find a place where you can park your car and underpass. Quarter-size hail can cause damage to vehicles. So I would just ask that people understand that there's a really strong storm that's popping up, and you see it's now also materializing and impacting more of central Erie County. If we could go back, I'll get rid of this, and we'll go back to the PowerPoint. Actually, you can just keep it there. I'll just do a little maneuver here. So you can then see the presentation fully on the screen. But that is a very concerning storm, and I would suggest that people take cover if they are in its way. The testing sites, the Calida site continues, the Leroy Coles Junior Testing Site at East Sullivan near Bailey, open 9 a.m. to 5 p.m. It's by appointment only. Need a lab order from your primary care provider for all sites except the Leroy Coles Library. It is through Calida. It is primarily for residents in the zip codes you see on the screen, but it is just one of a multiple set of Calida sites, including Worley Drive, Best Street, Union Road. They're all by appointment only at 859-3222, so there's lots of testing available through our partners at Calida Health. The New York State Department of Health has a testing site in the Cobblestone District in downtown Buffalo. For those that are basically healthcare workers, essential workers, it's by appointment only. 888-364-3065 is the COVID-19 hotline to register and get an appointment at the site in downtown Buffalo. Jericho Road is doing testing. Today they're doing testing at the Buffalo Myanmar Indigenous Christian Fellowship because, as I talked about on Wednesday, we are seeing an outbreak among individuals in the Burmese/Karen community. We're very concerned about that. I want to thank Dr. Myron Glick and his staff at Jericho Road that's working with our Department of Health to try to keep this outbreak down. But Jericho Road has a number of other tests coming up, including at its Barton Street location on May 19th at 8 Days of Hope, and at its Broadway location in future days. This is first come, first serve. You do not need to be a Jericho Road patient. Have insurance, have a lab order, make an appointment. It's first come, first serve. Tests, though, are administered at the provider's discretion through Jericho Road. Bring a photo ID and insurance card with you if you have insurance. ECMC. ECMC, as we announced, is doing testing through the ECMC and Millennium Collaborative at many different locations in our region. There's actually 27 testing sites in our region, and it includes 15 high-risk zip codes based on what we're seeing with the results of positives. And locations include the ones you see on the screen. To set up an appointment, you have to contact the private practice group. So if you wanted to get one done in your neighborhood, and you can go to the ECMC site and you will see the list of where they are. If you are a patient of one of these practice groups, you can get tested, but you have to call them to set up an appointment. Commissioner's orders, turn it back over to Dr. Burstein, what that means.
Thank you. So remember, the reason that we are doing testing is so we can identify people who are infected with COVID-19, remove them from the rest of the community. It could be wanted to break that chain of transmission. So the question is, who is subject to the commissioner's orders for isolation? So anybody who has symptoms of COVID-19 when the specimen is collection, so when you have your nose swab, should remain in isolation until you receive a negative test, or if you're positive, until you meet the criteria to be released from isolation. For people who do not have symptoms and they get tested for COVID-19 and they get a positive test result, at the time that they get their positive test result, that is when they start isolation. So if somebody doesn't have any symptoms and they go in for COVID-19 testing, they do not have to start isolation when they get the test specimen taken. That's only for symptomatic people that would wait until if they get a positive test result. So again, asymptomatic people start isolation if they get a positive test result. Anybody who develops symptoms between the time that they're had the specimen collected and they're waiting for a retest result should put themselves in isolation because they very well should be positive. So again, the big picture: positive test result, symptoms, be in isolation. Negative test result or no symptoms, don't have a positive test, don't have to be in isolation.
Thank you, Doctor. The reopening status is the latest. We've met 5 of the 7 metrics. We are having problems with the hospitalizations, as we talked about, and the deaths. I was hopeful we saw a lessening of deaths, at least yesterday, and then a tick back up over 5 from the hospital. These are not all deaths. There were 11 people that died in Erie County alone yesterday. We do look at the hospitalization deaths when it comes to metrics as well as the hospitalizations. We have seen a decline in the total number of patients over the last 14 days, but it's not just based on that. It's also based on a 3-day rolling average. I've been in conversation with state officials. We don't always agree with the numbers that they're showing, but we do know that there are hospitalization increases in the last few days. We saw a nice little decrease as pertains to this number here that the state has for the 14th. We do not have data yet for the 14th for Erie County. We only have the information through the 13th, and the state put this up earlier because truthfully they have the data before everyone else. So we need to do a little bit better on the hospitalizations for the reopening. I do have some important information for our members of the business community. New York State yesterday released a template to the business community for reopening. No business may reopen unless they have a reopening plan in place. If you do not have a plan in place, when we finally get to reopening, we will unfortunately, you may not be able to reopen. And everything's going on here. We're even losing lights in our room here. So I don't know what's going on outside. It's worrying me a little. But in the reopening plan is such that there's a template that New York State has provided. I requested them to put a template up about a week ago. They have been putting the templates up, or they just put the template up for the first time. You do not need to follow the template word for word, but you need to have a plan. If you do not have a plan, you cannot reopen. And it's very important that you have a plan. You can find the template that New York State has on its website at forward.ny.gov. And there's specific templates for different industries. So if you're in the construction industry, that template's going to be a little different than the one for the manufacturing industry and the retail industry. It does not need to be submitted to the state. It does not need to be submitted to the county. You do need to keep it on site. And it must be available for employees, New York State Department of Health, or other safety authorities in the event of an inspection, and if they ask for it. Very similar to when you see the wall of what you will see, like the minimum wage signs and things like that. You need to have something in your business that says you have the plan on record. And if somebody asks for it, you got to provide it to them. You are also required to provide an affirmation to New York State. I think I jumped a little ahead there. But you can get guidance, and you have to do an affirmation to New York State saying that you have put together a plan. It is available for public review. And it is important and incumbent upon every business owner to do that. And you should do it now rather than wait until we get to the reopening phase, because it's important that you have it in place so you can reopen on whatever day we technically reopen on. So I would suggest to all in the retail, the construction, as well as the manufacturing industries. We're not yet in phase one. I don't know when we'll get there, but when we do, for you to reopen, you have to have a plan in place. So start working on that plan now, have it in place, do your affirmation even before the reopening, and then you could open on that day.
Mark, if I could
Yep.
just add that the Centers for Disease Control and Prevention actually has some great recommendations about how to make your business safe or the workplace safe in COVID-19 environment. So I encourage all the business owners to go to that CDC website. You can just do a search on the CDC's engine, www.cdc.gov, and find some great recommendations so you can make it easy to fill in that template for you.
Thank you, Doctor. And on the screen, you see the Business Task Force resources for businesses. We do have a PPE vendor list for businesses from vendors that we are working with that are available for sale to the general public, not like in ones or twos, but in boxes for businesses. So you can go to erie.gov/COVID19/PPE vendors. That's VENDORS. Our Erie Grown website has grown. We have now more than 40 farmers that are participating, and we've had a lot of people reaching out. Even got an email from a reporter who's probably watching right now saying he's using, at least I said it's a male, I said he is using the Erie Grown site to get in contact with a local farm and buying produce from the local farm. We want to encourage growth in our economy as best as we can, even in these difficult days, and we've done that through the Erie Grown site. It connects farmers with the public and public with the farmers, so you can buy fresh produce, fresh goods straight from the farm. The ECIDA, of course, has a relief loan program, which is available. You can call 856-6525. I know a lot of people are taking advantage of the federal loan program, but there is a local one as well. And if you need a little additional help, the local program is available. And the partnership, the Buffalo Niagara Partnership, has a business link with information connecting businesses that you can get to at thepartnership.org/businesslink. And for business owners that are looking to get in contact with maybe another business with regards to supplies or something like that and don't know how to do it at this strange time, go to the business link at the Buffalo Niagara Partnership's website. New York Forward, of course, that is what is guiding all regions with regards to reopening. The regional monitoring dashboard is there. The monitoring dashboard with regards to our hospitalizations is there. It gives the information on industries reopening by phase as well as the templates. It is available at forward.ny.gov. That is the site to go to for the latest information from New York State on reopening. And I'll turn it over to Dr. Burstein to finish.
Thank you. So, just like donations, people have to start, just like immunizations, people have to keep thinking about keeping their kids and themselves up to date with immunizations. We still have continuing demands for blood donations. So we hear from Connect Life that over the past 2 weeks, the hospital has had an increasing need for blood donations, actually 20%. So that's pretty significant. So now that the hospitals are going to resume performing elective surgeries, and there are still urgent surgeries that need to go on. They need that blood. They need those blood products. So there are ways that you can help. We're just if many people are just sitting around not being able to go back to work, you can donate blood. People can donate blood actually every 56 days. You can sponsor a blood drive. You can call Connect Life at 716-529-4270 and find out how to donate blood and how to get involved, or the American Red Cross at 716-886-7500. So those are all ways that people can be involved. And please give blood. Remember, it's the gift of life.
Thank you, Dr. Burstein. I'm going to go back to the weather map, so to speak. The severe thunderstorm warning appears to have been canceled for Erie County, but it still exists for Wyoming County, and I would not be surprised to see the National Weather Service, which handles almost all of upstate New York through at least Syracuse, extending that elsewhere. And you can see there's some pretty strong storms coming in otherwise, so we're in for probably a rough afternoon, and recommend that everybody who's in the line of those storms take a cover, because there were 60-mile-per-hour winds, gusts reported, as well as quarter-sized hail. With that, we will go back and just start taking questions from the media, and we'll start off. My little button here. So, from our friends in the media, we will start off. I think we started on the top last time, so we'll start at the bottom of my list. Ashley Rowe, WKBW.
Hi, Mark. I recall a few weeks ago you had mentioned that there were a strikingly low number of business owners who had applied to your ECIDA programs and small business loans, et cetera. Have you received more applications to the county business loans?
The Erie County Industrial Development Agency has received more inquiries, though I do not believe they've actually received that many more new applications. That's why we're highlighting it as well, because we want people, business owners, to know it's out there, and it is it's a resource for them to take advantage of. And once again, to those that are on the waiting to call, if you could just mute your phones until I announce that it's your turn, just so we don't get a lot of the feedback. WIVB, George Rickert. George.
Hi, Mark. Beaches. This governor announced today they plan to open state beaches. Do you think that's a good idea? And do you plan to open Went Beach, for example, any Erie County beach next Friday, like state beaches?
Our county beaches would not be open normally until mid-June. So this is a little premature. It's a little different, usually a warmer down in the New York City area, Long Island. Our beaches would not normally be open until June, and then of course we're not going to be able to open any beach that's a county beach until we actually have lifeguards available. And at this point we do not have that in place. So for now it's kind of a premature for Erie County at least. WGRZ, Kelly Dudzig.
Hi. So were the 4 people from outside of Western New York that you mentioned admitted to local who were admitted to local hospitals? When were they admitted to local hospitals? Did it happen to be in the last 3 days?
I do not have that information. All I know is that based on the information that was provided to me, that there were 4 individuals in Erie County hospitals that their place of residence was outside of the the Western New York Regional Economic Development Council zone, which would be Erie, Niagara, Chautauqua, Cattaraugus, and Allegheny counties. They were all New Yorkers, but they lived elsewhere in New York State.
And do you know if they happened to be nursing home residents, or were they from private residents, or do you not have that info?
I don't have that information.
Okay. All right, thank you.
You're welcome. Michael Mroziak, WBFO.
Actually, George asked the question for me. I'm good.
Okay. Mike Baggerman, then, WBEN.
Hey, Mark. Looking at the new numbers, the state metrics that Western New York has now met 5 of the 7. But one of them that looks like it's going to be, back and forth is the new hospitalization numbers. When you look at them fluctuate so much, I mean, how maddening would you characterize, how much it changes given every single day is a new challenge?
Maddening is a good word. Frustrating is a good word. It's just, I've been talking about it. That's something that is out of the control of Erie County. It's out of the control of New York State. It's really in the hands of the public, and that's why I wanted to show, and I'll go back and find it, the one slide that shows the increase in hospitalizations from the 12th to the 13th, and how the growth was in the under 64 and under category, and there were even 2 more people that were aged 20 to 22, or 20 to 44, excuse me, as compared to the day before, and I know it was 20 the day before that. So the growth is not just nursing home patients. It's not, I mean, if it was the 65 and above category, we actually would have gone down even more if the other 2 had just stayed the same, because there was a drop in the 65 to 84 category, and there was a very slight increase in the 85 and above. So it is maddening, because this is something that can be controlled by proper social distancing, people wearing their masks when they're out in public. And if we continue to see growth in that category, and it's not individuals who live in nursing homes, then it's just really out of my hands, but it's in the hands of the public. So yeah, it's maddening, it's frustrating, and I want to reopen as much as anybody. I mean, I've got family I haven't seen in a while. I got a hair that's growing like a weed. I want to get us in a reopening phase. I want our businesses to reopen, but we have to do it safely. And I agree, we're not going to reopen until we feel it's safe to do it. And the state has set the law down. I agree, we've got to do what's right to protect our community, it's public health. I want to reopen to grow the economy. I mean, economies recover, people who die do not. It's as simple as that. And we need to do its best to protect the public's health so that we can then reopen the economy. Our economy will recover. It might take some time, but it will recover. But if somebody dies needlessly that shouldn't because they were exposed to COVID-19, they're not coming back. So we as a community need to do its best to protect all. And I think if we do that, then fairly soon, I've been saying all along, I think we'll reopen by June 1st. But if these numbers keep on bouncing and we keep on having increases and decreases, increases and decreases, it's going to be tough for the state to say, go ahead and open. We won't meet the metrics. Stephen Marth, Spectrum News.
Thank you, Mark. This question is for Dr. Burstein. The governor recently has been talking about home spread contributing to a number of new cases that are being reported in the state. How can people stop the spread of COVID-19 in their homes in these situations?
Well, that's a tricky situation because people are living in close quarters. So that's why what we recommend if somebody is diagnosed with COVID-19, they have a positive test, that they stay in isolation. So that means that they should be isolated not only from the rest of the people in the community, that would also include the people in their household. So they should, again, stay in their own room, and they should, if they can, use their own bathroom. If they have to share a bathroom when they go out of the room, they should wear a mask. They should make sure that they disinfect the bathroom as best they can after they leave. So it's, but it's tough, and we know that there are people within households that are infecting each other. And if there are individuals that are living in situations where they can't stay in isolation just because of the makeup of the housing, we have a facility, a hotel that we are putting people up in Erie County that don't have any other health conditions. We can't provide health care, but if they're otherwise well enough to stay at home, they don't need to be in a hospital, then we can house those individuals in a hotel that we're putting people up in isolation and quarantine. So we really encourage people to take advantage of that if they know that wherever their situation is, they aren't going to be able to remain in isolation. But that is a problem, and again, that's why we have to try to encourage wearing masks and isolating even inside your own home. And we also encourage all household contacts to get a test to make sure that they're not infected.
Thank you.
Sure.
Thank you, Doc. The National Weather Service has extended the severe thunderstorm warning for the eastern part of Wyoming County as well as Livingston County until 4 p.m. So for those that may be in the viewing area watching this, it is a strong storm with gusts up to 60 miles per hour, as well as quarter-inch hail being reported, and lots of ground to cloud or cloud to ground lightning. So be careful out there. Investigative Post. Anybody on from Investigative Post? Buffalo News. Anybody on from Buffalo News? Buffalo Business First. It's all yours, Ethan Powers from the B News.
Hey, Mark, hope all is well. You mentioned on Wednesday that you'd be talking to congressional representatives and advocating for the passage of another federal stimulus round. I was wondering if you could give us a few details about the nature of those conversations. And just as a quick follow-up, the White House has already talked about potentially vetoing the House's bill. If that happens, what's your thoughts on a contingency plan for county governments that might be looking at the prospect of huge shortfalls with no federal help on the way?
Well, we did have a good conversation. It was myself, Judge Gary Moore, who's the county executive, but they call them county judges, down from Boone County, Kentucky, Marianne Borgeson from Douglas County, Nebraska, an administrator from a county in California, as well as representatives from the National Association of Counties and congressional members, as well as their staff. I'm not certain about leadership. But there was a good conversation. They understand the difficulties that counties across the United States are dealing with. It's not just revenue losses, it's also increased costs for services, as we have increased costs for new temporary assistance for needy family cases, safety net cases, which is 100% county share, supplemental nutrition assistance program, that's the food stamps program. So they're very aware of it. I think the House's bill that is being voted on today is the first volley, so to speak. I do not see that getting passed in the current format in the Senate, but there does appear to be significant conversations between the House and the Senate, as well as the White House, to the passage of another bill. It may not be the HEROES Act that has been proposed and will probably pass the House today, but I do feel confident that something will get passed. Now, the timing on it, I'm not exactly certain. We had hoped that it was going to get done by Memorial Day, but the latest information we have from Senator Schumer is it may take a little longer, and that's a little concerning. Because if it takes long enough, I'm going to have to implement something to ensure that we end up with a budget that is balanced. We can get through May because of recent actions that the legislature has taken. We can probably get through June too, due to actions that the legislature has taken to allocate the 2019 positive variance, the surplus, to a COVID-19 fund. So I do believe we're in a stronger position than we were not too long ago. But if once we start talking about July, that's a whole other story. So it's given us a little bit more time, but in the meantime, we're putting up our plan to address it. Ashley Rowe, WKBW, any more questions?
I'm all set. Thanks, Mark.
Thank you. George Rickard, WIVB, any more questions? Guess not. Kelly Dudzig from WGRZ, any more questions?
I'm good, thank you.
All right. Mike Mroziak,
Hey,
WBFO?
Mark?
Yep.
George, I do have a question.
Okay, George.
It's too late to get my question?
No, go ahead.
Are we mathematically eliminated from reopening late next week? I know the metrics are complicated, and we hear a lot about 14-day windows and 3-day rolling averages. But is it safe to say that if everything goes right for 4 or 5 days, that we still could technically reopen late next week, or are we locked into a 14-day window?
Well, if things go well with the 3-day rolling averages, then yes, we could reopen or have a date for reopening. If the most recent trend continues, in which we go up, down, up, down, up, down, on the deaths as well as hospitalizations, then it's going to be tough. But mathematically, we are not eliminated. But if we continue the most recent trend of up, down, then it's going to be tough.
Okay.
Okay, Michael Mroziak, WBFO, any more? Mike Baggerman, WBEN.
Hey, Mark, I want to get just a little bit more understanding of some of the data that gets reported between the state and the local. There's like a discrepancy that I'm noticing. The state reported that there was 214 hospitalizations on Wednesday. Erie County is reporting 201, but Niagara County has been reporting the number 20. Together, that means there's a discrepancy between the local and the state. Do you have any insight onto what's determining the hospitalizations, or why there's some different figures that are being thrown out there?
I do not. I do not see the other counties' hospital data. We do have a call at 4 o'clock with other county officials, as well as Lieutenant Governor and state officials. And now that you bring that up, I will discuss that. I don't know why that would be the case. The only thing I could think of is it could be for different days. Remember, the information that the state just put out for May 14th, we will get that data from the state later today, and then we'll show you and they'll be sharing it with every county later today, and then we'll be able to show you the county-specific data tomorrow. Maybe there's just a couple of days that are mixed up that are different, but I couldn't answer that question. Spectrum News, Stephen Marth.
Thanks, Mark. This question's for yourself or Dr. Burstein, whoever feels best to answer it. But obviously, the governor and both of you two spoke today about pediatric multi-system inflammatory syndrome. The governor, in his remarks earlier, made it clear that while there's over 100 cases in the state, there are 100 known cases. Obviously, Erie County is looking at a couple suspected cases as well. Parents, obviously, with schools being done for the year, are getting antsy, looking at the summer, and a lot are questioning about summer camps. Do you think, with the new developments with the pediatric multi-system inflammatory syndrome, that it's wise for the school-age summer camps to exist in any capacity this summer?
I don't know if I'm the right person to be answering that question. I have a Juris Doctorate, but I am not a MD doctorate. That would be the person over there, our pediatrician, Dr. Burstein. I don't know. I really don't. I can't answer that question. Dr. Burstein, would you like
Sure.
to
Well,
take a shot?
Sure. First of all, it's up to the New York State Health Department to determine whether summer camps will allow to be open or not. So far, they have not advised us as to whether summer camps will be open, so we're in a waiting pattern. But, regardless, whatever type of, social gathering that you may put yourself or your children at risk for is a risk for developing COVID-19. So even if summer camps are open, I mean, we hope that, people make the right choice and the best choice for them and decide to take action of what is safest. But again, right now, we don't know that the summer camps will be open. So we're waiting for New York State Health Department to provide us with guidance.
Thank you.
Thank you.
Thanks. Ethan Powers, any more questions?
I'm all set for today, Mark. Thanks.
Okay, is there anyone else on the phone that I have not called upon? If not, thank you everyone for our COVID-19 update for May 15th, as well as continuing weather report. It appears that the storm has passed through Erie County, but is still hitting Wyoming County and areas eastward. There are expected additional storms to crop up through the day, so be careful. I would not recommend doing outdoor activities for the remainder of today. And tomorrow looks like it's going to be a really wonderful day, a day that I think we all are looking forward to. Please be smart, be safe, wear your masks when you're out in public. I have mine. And one final thing, I actually signed an executive order that anybody who is working in county government buildings or is a patron or visitor to county government must have a mask on. We've had some indication of individuals refusing to wear masks when they come in, and we believe for the safety of our employees, you need to have a mask, otherwise you will not be offered admittance to county offices. So that goes into effect effective today. The only place you do not need to wear a mask in county government is if you're at your own workstation and you can safely socially distant. But if you're among the others, working the floors, as we've been doing, we've been wearing masks. And if you're going to enter county government buildings for any type of service, or you're an invitee or one of our contractors doing work, you have to have a mask on while you're working in county government. Make certain that you have your masks when you go about your business on a daily basis. And until I see you again, which will probably be on Monday, most importantly, be safe and well, everyone. Take care.